Well, thank you so much, Bonnie, and thank you every one of the presenters. This was really insightful, and a lot of information is getting shared on the chat. I hope people are taking advantage of that as well, and then taking notes of things because you don't want to miss out on this. Um, we'll dive right into our next presentation, and the person presenting next is currently the Director of Public Policy for the Alzheimer's Association, Wisconsin chapter, where he represents the Association on Wisconsin State Dementia Plan Steering Committee. He has presented for the Alzheimer's Association at national conferences, including the 2019 National Home and Community Based Services Conference, hosted by the National Association of States United for Aging and Disabilities. Prior to joining the Alzheimer's Association, this person spent 20 years in Wisconsin state government, including 15 years working for legislators in the Wisconsin State Assembly and 5 years as a gubernatorial appointee in executive level state agency management. He holds a bachelor's degree from the University of Wisconsin-Madison. Please help me welcome Michael Bruhn.
Good morning, and thank you, Binta, and thank you, Fatu, for having me this morning share a little bit about what I do and what we do at the Alzheimer's Association. Good morning. I guess it's good afternoon now, everyone else. My name is Michael Bruhn, and as Binta mentioned, I'm the Director of Public Policy for the Alzheimer's Association Wisconsin chapter. Now, I know a lot of you have heard a lot of facts and figures and a bunch of other information about Alzheimer's and dementia over the course of the past 2 days of this conference. Things like we have more than 120,000 people currently living with the disease in the state of Wisconsin. And when a friend of mine from the world of sports in Wisconsin, he talks about that number, he always puts up a striking image, and it's an image of Lambeau Field and Miller Park side by side. And the striking thing about that is these two stadiums combined and filled to capacity could not hold the population of Wisconsin that has Alzheimer's disease. Now, I want you to think about another number. This is an easy number to remember. It's the number one. One. That is the number of people employed in the entire state of Wisconsin whose full-time job it is to influence state and federal lawmakers, as well as agency staff, to improve the lives of individuals with Alzheimer's and every other dementia, as well as their caregivers. But quite honestly, I can't do this alone, and that's why the Alzheimer's Association has the best volunteer advocates in the entire nation. We have people like Fatu, who is the volunteer Alzheimer's ambassador for Congressman Mark Pocan. And Fatu is one of 535 volunteer advocates from across the nation. We have one for each member of Congress and US Senator who have a one-to-one relationship with that member of Congress. The Alzheimer's Association doesn't expect, though, that that ambassador can do everything on their own, educating and communicating with their members of Congress. So we also have what we call Alzheimer's congressional teams, or ACTs for short. We in public policy, we absolutely love our acronyms. Wouldn't be public policy or politics without an acronym. So our ACT or ACT teams. And these teams support their ambassadors' efforts to influence the members of Congress. Now, we also have a state government, obviously, and the Alzheimer's Association is a program for that. And we call those our state champions. And that program is also modeled on the success of our ambassador program that's geared towards influencing our state lawmakers. The volunteer advocacy programs seek to influence elected officials through a variety of different methods. We use everything from in-person meetings, obviously when allowed and safe, letters to the editor, social media posts, attending town halls, advocating at and attending our advocacy forum in Washington, D.C., as well as our Alzheimer's Advocacy Day in Madison. We actually host the 5th largest Alzheimer's Advocacy Day in the entire nation, and we have my own horn just a little bit, but it's really a statement on all of you who come and attend. We have the largest Alzheimer's Advocacy Day in the entire nation for a state that has only one public policy staff member. So that's a really cool thing for our state. If you'd like more information on these programs or would like to become a volunteer advocate for the Alzheimer's Association, please contact me or Fatu. She can connect us. So why are these volunteer advocacy positions so important? Well, quite honestly, because the success at the Alzheimer's Association is a direct result of our fantastic volunteer advocates, our Purple Army or Purple Brigade, if you will. And every discussion that we have about Alzheimer's policy victories must begin with the historic increases in Alzheimer's disease research funding our volunteer advocates have secured in Congress. In 2011, Alzheimer's disease research funding was not even $450 million a year. And in fiscal year 2020, annual Alzheimer's disease research funding was $2.8 billion each year. And I'm proud to say we're not done yet. The US Senate included an additional $354 million in their appropriations bill for fiscal year 2021. So with that, and with a push by our advocates to include it in the ultimate bill, appropriations bill that gets signed into law, Alzheimer's disease research funding could reach over $3 billion annually by January. Truly, truly remarkable. Earlier this year, in the midst of a global pandemic, with the help of our volunteer advocates, we passed the Promoting Alzheimer's Awareness to Prevent Elder Abuse Act through both houses of Congress. I know that's a mouthful, but really this legislation requires the US Department of Justice to develop training materials to assist professionals supporting the victims of abuse and other crimes who are living with Alzheimer's and other dementias. This is a real tremendous success story. The bill was supposed to be introduced during our annual advocacy forum in Washington, D.C., that was canceled this past spring. However, in less than 8 months, we have went from introduction to passage of this important legislation. In the remaining days of this Congress, our top priority is the Improving Hope Act. A few years ago, the Alzheimer's Association introduced the Hope Act. This legislation required the federal government to create a Medicare billing code for health professionals to assist with the care planning for individuals who are diagnosed with Alzheimer's or dementia. Unfortunately, what we found is less than 1% of eligible individuals diagnosed have utilized this care planning that's provided under Medicare. So what do you do when the Hope Act doesn't work quite as well as you expect? Well, at the Alzheimer's Association, we introduced the Improving Hope Act. This act is designed to educate clinicians on Alzheimer's and dementia and on the care planning services that are available through Medicare, and really why it's so important that we have individuals receive those care planning services. We're already hard at work on a couple of very cool new priorities for next year. It's a little too early to share those details yet. We just got a little bit of a sample last week, but I just want you to know we are very excited about the new legislation at the federal level coming in 2021. At the state level, the Alzheimer's Association is leading the way to safeguard residents of long-term care facilities. The Alzheimer's Association made a series of recommendations encouraging both state and federal elected officials to take action to protect our most vulnerable citizens from COVID-19 in long-term care facilities, as well as encouraging states to establish standards for things like testing, reporting, surge activation, providing support, amongst other things. In August, we launched our first ever coordinated advocacy campaign targeting all 50 state governments and all 50 state governors, in an effort to address the rapid deterioration of loved ones in long-term care facilities due to social isolation caused by the COVID-19 pandemic that has absolutely restricted visitation. The Alzheimer's Association is advocating that the only way to safely end social isolation for our loved ones in these facilities is to ensure every long-term care community has access to rapid care testing, not only for residents and staff, but so that visitors can come in and visit their loved ones. In September, advocates from across Wisconsin and across the nation urged our governors to take action on this extraordinarily important issue. In the state of Wisconsin in 2021, the Alzheimer's Association is advocating for a full statewide expansion of the Dementia Care Specialist Program. You heard Joy talk a little bit previously about the importance of this program. She's a much better salesperson on this program than I am, but we are thrilled to work with our dementia care specialists in the ADRCs, supporting family caregivers, and in really ensuring that highest quality of life for people who have dementia who are remaining living at home. These positions provide cognitive screens, programs that engage individuals with dementia and regular exercise, social activity, promote independence for individuals with Alzheimer's. They're truly, truly important and really one of the most cost-effective things that our state government can do to influence and improve the lives of those with Alzheimer's and their caregivers. The Alzheimer's Association is also supporting the recommendations of the Governor's Task Force on Caregiving and advocating that the recommendations be included in the 2021-2023 state budget. It's no secret to all of you who are here today that caregiving is in crisis throughout Wisconsin and in need of the formal recommendations of the Governor's Task Force on Caregiving. There were 16 different recommendations, but the Alzheimer's Association is particularly interested in the Credit for Caring Act and the Medicaid nursing home and personal care reform proposals. The Credit for Caring Act will reduce the financial impact associated with being a family caregiver by creating a state income tax credit for qualified expenses incurred by family caregivers in Wisconsin. And the Medicaid nursing home and personal care reform proposal would ensure that budgeting for these services in the future would be more directly tied to paying for specified percentage of the actual cost of care, that'd be for nursing homes, and the estimated hourly wage to be paid for personal care workers, so on the home side. This proposal would allow for patients with Alzheimer's and dementia to receive a higher reimbursement rate that is commensurate with the significantly higher cost of providing services to these individuals. As I said, our success in advocating for these and many other issues comes from our volunteer advocates. Having lost 3 grandparents to this horrible disease, there are times when I felt helpless and wanted to fight back. And what I've found is the best way to fight back currently is through our public policy victories and provide supports and services to those individuals in need, as well as additional research funding. If you're interested in becoming an advocate, you can visit our website, alzimpact.org/volunteer, or text ALSVOL to 52886. I'll be sure to chat that in for you into the chat. And finally, I want to take this opportunity to personally invite you all to attend our 2021 Wisconsin Alzheimer's Advocacy Day. While it's obviously going to look a little different next year, we're still looking forward to a very impactful experience. It's the only day dedicated specifically to advocating on behalf of those individuals with Alzheimer's and dementia. We're currently putting the finishing touches on what we hope is going to be a very exciting virtual program in 2021. So please keep your eyes open for invitations coming soon. And we hope to see you all there. And thank you.
Thank you, Michael. Can you please join me in giving him a round of applause? And yes, we will all be waiting up on those invitations. And I know it's been an hour and we've had a lot of experiences going on. So we'll take a short 5-minute break and we'll reconvene at 12:20. So you can leave it on, just mute, get on the mute and maybe close your videos, and then we'll be back here at 12:20 for more exciting and informative sessions. Thank you. Yeah. Wait, no more.
Nakabilo barakata
Blessed be your name.
Ninye kabila kendoje musu kendo lebelo ringakuma tunyalem na kabilo barakata kende kele tumumengite numusu ya bangu mama hanitare kola nino tekela noila mama mama musongania senemo itelemira benteto hanibi njikita kenganyandi kuninganya tanyaminga kengana yengoti kuna mama muso onayata kuna mama muso ninkabilo kangana nunana kanuni ngakilo Bobe tulaten tenakabalo Illa kuluro maralo anin karandire niman Ulimu ila dinga lima taman seroti Yeo sifaling nole kadamfa Ding sulo tala falo lebebuela Mama muso Nayataranga penge karahibulu Utole nukanga kilo tuzobea Tilingwa aningwa kimola kumaya to Kuma mama muso Onaya tarebuta Kuma mama muso Yinkabilo kangana nunana Kanune wakilo yele kele Bobe tulaten tenakabalo Itele yatima Ntefuta tajali asubima to ninte budu Mamake Itele yatima Nteye ninjali asinota Kamfuta nina roma Julu,